Going up the stairs might be unpleasant or even painful, but going down puts a lot greater strain on the knees. The impact on the kneecap when going downstairs is 3.5 times your body weight. This means that if you weigh 150 pounds, your knees must sustain a force of 525 pounds. This is a lot to bear for such a little surface area, which explains why so many individuals have trouble descending stairs. The main reasons behind this are as follows. 1. It band syndrome. Repetitive knee bending activities such as jogging, biking, or hiking are common causes of this ailment. The iliotibial band, often known as the it band, is a tendon that extends from the pelvis to the top of the shin and across the side of the knee. If your it band is inflamed, it can cause considerable knee discomfort when ascending stairs because of its link to the knee. 2. Ligament damage. The ACL and MCL are two ligaments that connect the knee. If these ligaments have been sprained or torn as a result of an injury, ascending stairs will be painful. Ligament injuries to the knee can be severe and require surgery. 3. Injury compensation. When your foot or ankle is injured, it might alter the way you stand and walk. You change your body's biomechanics by compensating for the injury and putting too much weight on your knee when going down the stairs. This can be painful, and you may need biomechanical help to modify your gait. 4. Knee osteoarthritis. The cartilage that supports your knee might wear down over time, causing bones to move unevenly and without appropriate cushioning. In the United States alone, osteoarthritis affects more than 32.5 million individuals, with knee osteoarthritis accounting for more than 80% of cases. Knee osteoarthritis symptoms include grinding or clicking in the knee when moving, inflammation, soreness, and stiffness after sitting or lying down for long periods of time. Make sure you step onto the steps with your entire foot, not just your toes, to avoid knee pain going down and upstairs. Walking on your toes might put pressure on your knee and produce pain. Push off from your outside heel when ascending. This increases the efficacy of your gluteus muscles while reducing knee strain. Also, avoid walking upstairs with your knee out of alignment with your foot. A knee that is inclined inward might cause discomfort and subsequent damage. Click the link in the description to learn how I relieved my knee pain using a 5-minute simple before bed ritual, and subscribe for daily videos helping you feel well. Thanks for watching.